Ann, it's nice to meet you.
You too.
Yeah, I've been looking forward to this since we had our conversation on the phone. I'm really interested in the therapy that you offer, the ketamine therapy. Um, I'm hoping today we can kind of go down and kind of get a backstory on how you got into the line of work that you're in now.
Mm-hmm.
So,
So I've been involved in kind of social services things for a long time. I served on boards at a domestic violence shelter, the Midwest Innocence Project that works with people to exonerate people that are wrongfully incarcerated. In 2009, Governor Nixon appointed me to the Child Abuse and Neglect Review Board. So I've been in serving populations with various needs for a long time. My first therapy job was at MOXA, which is Metropolitan Organization to Counter Sexual Assault. And in that position, I worked with men, women, children. I worked through Jackson County Family Court with kids with problematic sexual behavior that were on probation. So I've been in those kind of serving fields and spaces and volunteer roles, leadership roles for a long time. I was working at MOXA when I was getting a credential. MOXA wanted me to get this advanced credential in a treatment modality. And to do that, you had to work individually with an approved consultant. The approved consultant I picked was in San Francisco. So I worked with her. And at that time, she had been in the ketamine space for a while. And she was also a sub-investigator on a clinical trial for MDMA. And I heard about it in my work with her. I didn't know anything about it. This is probably 2017, 2018. And I became very curious because MOXA, where I worked before, was really good about training their therapeutic staff on evidence-based practices. And I was trained in several, and they were effective. But I learned of this modality that, like, wow, this could be something. Mm-hmm. And had this real sense of, and I knew no one in the Midwest was doing it. I'd never heard of it. I did some searches, nothing. And I just felt like, okay, this, I'm curious. I want to know more about this. I went to training. in 2019. It was retreat style. It was we all dosed twice. I still went there with an amount of skepticism. I still needed to be convinced. It was so different from anything that was going around happening on the Midwest. So I went to training and I had my own medicine sessions. They were wonderful. I still think about them. I still connected to it. But the thing that really moved me and convinced me was witnessing other people's sessions. It was a cohort of about 40 people. Mm-hmm. So half would dose and, the other half would kind of facilitate for them. And then, we'd flip it. And just hearing people's experiences with expanded consciousness, it was just staggeringly beautiful. And I was really moved to do the work. It was, I can see how this helps.
Where was this retreat at?
It just happened to be in Austin, Texas.
Oh, really?
So it's a group. It's the Ketamine Training Center. And that was the first group to do training. Oh, okay. And they would go to different places. I got an email. They're going to Barcelona.
Oh, really?
I know. That'd be a nice trip, nice, right? Yeah. But they travel around. The head person, his name is Dr. Phil Wolfson.
Okay.
And he's one of the people that have been in the space for a long time. He's located in the Bay Area. Oh. Most of the people at this training were either ER docs, there was a group, or psychiatrists, or there was a group from a medical school in South Carolina they were about to do a clinical trial for CAP, ketamine-assisted psychotherapy for addiction. Mm-hmm. So yeah, it was a eclectic group from all over. Mm-hmm. So I was convinced. I went down skeptical. I came back convinced. It was not a strategic decision or a business decision to think, oh, no one's doing this. I'll do it. I'll fill this niche. It was more of this momentum and feeling I had that this is the work I want to do, that it's such a privilege to see people in this and really allowing them to expand their consciousness in witnessing that and reflecting it back to them and then helping them figure out ways like, how do I grow from this? How is this going to transform me?
And the reason why I ask, where was it at? Because I usually hear that people have to travel international in order to go on those type of treatments.
Not anymore.
Okay.
So
around when did that change? Do you know?
Well, you know what? It changed during COVID.
Oh, really?
Well, so, Ketamine Training Center, I think that was the only one for a while. During COVID, there was a group, and it's called Polaris, and they're also mostly in the Bay Area. They pivoted and they have all these online training modules. And these are people, actually, the woman I was getting that other credential with, she's heavily involved in it. So it's people that have been in the space, and some of the people are from the Ketamine Training Center. So they really did a good pivot at COVID, and they're offering, they offer retreats, which is a really nice way to learn a medicine.
Yeah.
And not everyone can do that. So they do these online training modules.
And it's good because you're in a group, like a very controlled environment. I'm sure people being able to watch you and guide you through that
and
process.
You can't do medicine. There's no remote training that's going to get you medicine, and really what you're learning. I have a personal ethic about not taking someone deeper than I'm willing to go.
Right.
So I have experience with ketamine. I was on clinical trials for psilocybin and 5-MeO-DMT. I have experience with that medicine. And I think that's important, that, I understand why the remote model works. And I understand, I have a personal ethic about having that experience.
Can you explain to me the differences between those, ketamine, 5-MeO-DMT, and what else did you list?
Psilocybin.
Psilocybin. Yeah.
Okay, so ketamine is a legal medicine. It's been around since the late 50s. It was synthesized by Park Davis. It's classified as a dissociative anesthetic. It was a battlefield medication in Vietnam and Afghanistan because it does not suppress respiration. IV can be administered ketamine can be administered through IV, intramuscular, nasal, or self-administered orally. That's the model I use because I'm not a person, I don't have a DEA license. I can't handle, store, dispense ketamine. So it's a medicine that's been around for a long time. As far as comparing it to the other medicines, 5-MeO and Sil, it's not as deep. The trip time is shorter. Well, 5-MeO is a short trip time, but it's really big. But so ketamine is not as deep. Like psilocybin and 5-MeO, you can go really deep.
Oh yeah.
And you can't with ketamine, you can't updose because you'll just get blank tape. At the end of the day, it's an anesthetic.
Yeah.
So there's no, Sil, you can updose and just have a bigger trip. But ketamine, there's some parameters around it. It's safe. Last year I stopped counting, even though I still mention it, but I've done over 300. Stopped counting last year. My little platform counts for me, but I stopped looking. But so and it's a safe medicine that people self-administer. And importantly, you can be on SSRIs. With those other medicines, you can't be on SSRIs. And SSRIs are not perfect.
Yeah.
They are symptom management. There's not a psychiatrist anywhere that will say, hey, this is a cure. But there's some people that are able to manage their symptoms on those medicines that need to stay on those medicines. So ketamine will always be around, I think, because you can be on your SSRI.
What's your feeling on SSRIs?
Well, that they do symptom management. And I think, honestly,
I feel like they get a bad rap, but it's got to be different from person to person.
Yeah. And I think psychiatrists are doing the best they can. They're working in this system where their reimbursement rates for insurance companies are minimal. There's a lot of pressure on them to keep the meetings brief. I think they're professionals. There's a lot of good ones in Kansas City. They care, but I think that they're working with the tools that they have.
Right.
I have, I don't have any clients that it's been a cure for them, but a lot of clients, it has been a process because you're trying medicine. You try this, you up the dose, you add a mood stabilizer, but they have some level of efficacy. So I think they do get a bad rap.
Yeah.
Yeah.
And I think it's better than the outcome of, where a lot of them lead to is suicide. So,
Yeah.
I mean, I feel like, nothing is a perfect fix or the end all solution, but at least we have, like you said, these tools to help,
Right.
And it sucks. Some people are going to take to them and some people are not,
Right.
and it's,
Right.
but luckily there's alternatives too,
Yeah.
like the treatment that you offer.
Yeah.
And hopefully soon here, other treatments are going to be available as well. I think I heard on one of the interviews you did, psilocybin's getting really close to.
Yeah, there's a bill in the Missouri legislature. It's the third year in a row. And you never know what's going to happen down there. But there's a lot of traction. There's a lot of interest. There's a lot of education going on about, the need for this. So I think whatever psychedelics become available, I think they will be in the context of a Western therapeutic model. And maybe some of the people on SSRIs won't need that. They'll start with maybe a psilocybin and work through that, and they'll never get on that.
Yeah.
I don't think.
Or some may be able to transition off
Yeah.
and only go to this.
Right.
Yeah.
Right. Yeah. Which is rough. I've been on a retreat with someone who was she was on SSRIs for a long time, and you had to get off them to do psilocybin, and it was pretty rough. So I think there'll be some movement. I have a lot of hope for the efficacy of psychedelic medicines, and I have caution. I don't think it's a panacea, and we can talk more about that. But and then 5-MeO DMT. Well, so that is kind of known as smoking toad. I can tell you no toads were harmed. Yeah. They synthesize it. They can replicate the molecule. In a clinical trial, they do an intramuscular. When I did it, it was, I hate to say that what's the word when you do crack? It's like I don't know, it's smoked.
Yeah, you smoke it?
Right. I guess I smoked it, but it just there's another word for it that's kind of like street name for it, but yeah, really? That's what I did. It's vaporized. It's a liquid that's vaporized, and I'm not sure if it was actual toad venom, if it was synthesized. I don't know.
Yeah,
I knew it when I did it, but so that's a really fast medicine. The clinical trial I was on was the first in human study for that.
Really?
So yeah, it was big. It was a phase 1. It was, it was kind of a big deal. It was in Overland Park, Kansas, if you can imagine that.
Really?
Yes. But so it's a big medicine. Like you blast off.
Yeah. How was your experience on that?
It was good. It was fast. It was.
Yeah, I've heard it can be sometimes just a total of 30 seconds to a minute.
But you have no idea.
Yeah.
You have no idea what. You completely lose track of it.
How long was yours? Do you know?
No. I think it was a little bit longer, but because I was kind of out of it. It's interesting though. I drove home.
Really?
You get back to baseline, which you don't do that. You won't do that with ketamine. Won't do that with psilocybin. But I drove home.
Yeah.
So you're up and down. But it was really
sorry about my
big.
chairs. I know they're kind of squeaky.
Yeah, that's okay. But it's a big experience, and I would advise anybody to use a very high degree of caution.
Yeah.
With that medicine, a high degree of caution.
Yeah. How was your experience on psilocybin? Like, I think we kind of glanced over that real quick.
I love that medicine.
Yeah.
I love that plant.
And that's my, favorite as well. I mean, it's the only one I've done. I've never done ketamine, never done 5-MeO. And I've only done psilocybin a handful of times. But it's starting to become a regular thing that I've enjoyed, even at the microdosing side of it. I know there's been some, I was listening to actually Dr. Huberman talk about if microdosing is actually, from what they've studied, what did he
Efficacy,
say?
I know.
Yeah,
And there's
like
no data to support it, but I
yeah,
microdose and
yeah,
I have for years.
and that's kind of what. And I'm wondering if it's more anecdotal or what's that? Whenever you
Placebo.
yeah, placebo.
Well,
Yeah.
I tell you what it does for me
Hmm.
is I just have good, vivid dreams.
Hmm.
And I believe that still opens up to your
Yeah.
consciousness and those dreams matter.
Yeah.
And I worked with a man end of life, and end of life is emotional, so I get kind of teary,
Yeah.
and I hope I don't. But he took his micros through his feeding tube
Hmm.
up to the end,
Yeah.
and he knew what he was doing. He knew what he wanted,
Yeah.
so he got something from it.
Yeah. As well, like what I get, and this is why I'm trying to figure out, since I've only done it a handful of times in my life, is trying to figure out if it is placebo. But at the same time, every time I've done it, I mean, I don't know how many times it could be that placebo effect, because the handful of times I have done it, microdosing or actual trips, it's been amazing, other than one I didn't have. And I don't know if that was just because of who I got it from. It may have just been something not good.
So you're talking about big doses and
Big
micro.
doses, yeah.
Well, big doses are not placebo.
Mhm.
I mean that.
That couldn't have been placebo. More of the microdosing being placebo.
Yeah.
Just because when I do it, like the other day, last Saturday when I did it, I took about a half a gram, and I felt just like a weight was lifted off of me, and then not like an immense weight, but I think in life sometimes we go through life and we're told to just grind and pull yourself up and just work and stop complaining and do. But weight, I feel like, is on top of us. Of all the things that we go through in life, our experiences, whatever it may be, mentally, emotionally, physically. And when I do it, it's like as if I feel like for a moment, and granted, it's only maybe like an hour, hour and a half, but that feels like it's off. And then afterwards, I feel still a little better, like a little lighter still, and it's not as much as it is in that small window of time, but it's as if it kind of has like a little bit of a shelf life. It continues throughout the day.
Yeah.
And then on the higher doses, the one that I can recall that I remember that has stuck out to me, I mean, that was just amazing. I don't even know. I've tried to explain it to people, the connectiveness I felt with the individual that I did it with life, with myself. I mean, I was very emotional. Everything felt vibrant. At the same time, there were some ups and downs, like kind of like a roller coaster. But once you kind of got over that hill, it was, I mean, probably the best experience, I've ever had. And, but yeah, so, I mean, that's been my experiences with that. Also, you going through all that, what was there anything maybe in your personal life that kind of led you to the field that you're working in? Anything like maybe younger childhood or, teenage, young adult? Like, have you thought about it, or was this recent? Because how many years have you been doing this?
Involved in kind of social service, probably. Well, so this is my second career. My first career was in human resources, which is, people, stuff. I took some time off when my kids were little and did a lot of volunteer work and board work and social services.
Yeah.
And I realized I want to work in that field, but I want to really work. I don't want to be a volunteer. My time is worth something. Volunteers, there's a limit to what they can do.
Yeah.
So I went back to school, got a master's in social work. And as far as being led to this work, I don't know. I think I've always been pretty empathetic, feeling like I want to do something that impacts people on a positive level. When I took a in college, I didn't know what I was going to do, but I took these tests and it's kind of funny because you think about it now, but I was either going to be a bartender or work at a funeral home. So that's someone that listens, someone that listens and is.
Well, even in human resources as
yeah,
well.
Exactly.
Yeah.
So I think I'm just, someone who would do that.
Mm-hmm.
Yeah.
Have you always been like that, even younger too?
Yeah. And I never thought I was.
You're always that friend that people could talk to.
Right.
Yeah.
Right. And I'm one of 5 kids. So it wasn't, I never had to stand out.
Yeah.
I never, it took a lot to stand out.
Yeah.
Family of 5. And I never felt like I needed to. I was always happy to assume a role that was a supportive role.
Mm-hmm.
So
you must be the middle child.
Second to the oldest.
Oh, really?
Yeah.
Okay.
Are you middle?
Oldest.
You're the oldest.
Yeah, I'm the oldest.
Yeah.
Yeah, I've got 4 younger brothers.
All boys?
Yeah, all
wow.
boys.
Yeah.
Hold on, I'm saying 4. Now I'm over here. No, hold on. Adriano, Madden, Julian. Yeah. 4. I don't know.
Yeah, you better
I was having a brain fart this morning.
Get that right.
Yeah, I'm like, let me count those real quick. I don't know why I had that right now, but yeah, no, I understand that, and also I think too, I think volunteering is great, and we need volunteers, but I honestly feel like if you can be, paid for the work that you do, I think that actually pushes people to actually do more and help more. And, because it takes the stress of financials and all that stuff off your plate, and then, so that's what led you to go into your second career path, which is what you're in now. Mm-hmm. And you, what's the name of your business?
KAP Kansas City.
Okay.
Yeah.
And then when did you start that?
In 2019.
2019. Mm-hmm. Okay. So it's not really new. It's kind of, we got about 6 years or 5 years. Yeah. How has that been on that journey?
It's good. I will say that being the only one doing it was difficult. Mm-hmm. It was, and for a while it was a side hustle. I was still working at Moxa. Mm-hmm. I did it in evenings and weekends. It was hard to find a prescriber. You need a prescriber, And
you were one of the first in Kansas City?
I was the first in the Midwest. I had people traveling from all over, Oklahoma, Arkansas, Nebraska. I have a client now from Indiana, but I had people from all over.
And so this kind of therapy was more readily available on the coast than...
Yeah, more so on the West Coast.
Right.
New York, yeah. But it's still really, it was, very open and available. Although when I was working with a woman that was on that other credential, I said, why are you still doing this? You're doing this ketamine and you've got this clinical trial experience. And she said, well, I don't know if this is going to be around. It was still, all of us were still taking a risk.
Right.
And the biggest risk for me, or not risk, but barrier, was finding a prescriber.
Right.
And that's, that's what you need. We need them more than they need us.
What is the process like on finding a prescriber?
Well, it's luck. It's a lot of them.
Has it become easier now?
Yeah, but I never take it for granted because I've had several. In 5 years, I've had several that have not done it for various reasons. So I do have someone I work with primarily now. There's someone I work with just because I have a relationship with him, and sometimes that's just more appropriate for someone to go see him. But they know the medicine. It's a physician. She's the medical director, but she has nurse practitioners. And so when someone comes to see me, we do the preparation session or sessions. It's just however many they need. I get quite a few referrals from other therapists where they come to me for medicine and then go back and work with their therapists. But people can self-refer. This is legal. It's safe. I think everyone has a right to explore their consciousness, and people will self-refer for whatever reason, even if they're not seeing a therapist. We talk a lot about integration, which is, learning, growing, transforming from your experience and how to do that. And sometimes that's having therapeutic support is the best way to do that. But anyway, so this woman, her office, they'll prescribe the medicine. it's pretty safe. There's not a lot of rule outs. They take blood pressure and come back. And we have a really good working relationship.
What is the process like? If I was to come to your practice, how does that look?
So you would reach out to me, most people through my website. And I touch base with them because I want to talk to them because I don't want to waste your time.
Right.
There's some things that people that aren't going to be okay with it. Unfortunately, this is very expensive.
Yeah.
And, that's a barrier for a lot of people. I don't want, come on in and I'll bill you $185 only to find out you can't do it. So we would connect, we would talk. And then if it makes sense, then you would come in for a preparation session or as many sessions as it takes, where I just find out about you. What do you want? What do you need? What's your experience? What's your history? What support systems do you have in place? We talk a lot about integration. Like, hey, this is going to be nice, but you have to do something with it. It's like they say in recovery, it only works if you work it. So we talk a lot about that. I talk about what the session will be like. I'm careful to help people manage their expectations around it. And then if it's a go with both of us, then we would schedule it and I would refer you to the prescriber. And then you'd come back for your session with your medicine and we do it. We do the CAP session.
Okay. And how does that session, how long is that?
I book 4 hours because I don't want to send anybody out.
Right. Just in case.
I mean, you can't drive home no matter what, but it feels abrupt if someone's still really processing and like, okay, well, your ride's here. So I spend some time when people get there settling in. Most people have some amount of nervousness that we talk about and work with. We kind of revisit their why. Why are you seeking this? And then ingest the medicine. It's a sublingual ingestion. So there's they're called troches, small waxy substances that you hold in your mouth for a period of time without spitting or swallowing. And you kind of swish it around so it makes contact with the skin on the inside of your mouth. And every single person lying on my couch has this internal narrative. Am I doing it right? While it's dissolving, I read a body meditation. And then when the time's up, I say, okay, you can spit or swallow. They have eye shades on. And I put on music. There's curated playlists that follow the arc of the medicine's experience. And most of the time it's internal. People are just in their head. And I tell them, I encourage that. There's nothing about me, nothing I can say or do that's going to be as cool and interesting and healing as your own inner healing wisdom, your own consciousness.
Right.
But some people want more. And if that's what they want, that's what they get. If I'm not working, just doing all the therapeutic stuff, I'm really careful about what I do. I do think that we're opening up a channel. I respect that channel. I'm not texting. I'm not doing billing. Sometimes I will read something that's relevant to the work, but I'm real, I respect that. I think there's a potential for joining of consciousness, that it's kind of a sacred space. So I'm doing my thing, they're doing their thing. And then the psychoactive part of it is anywhere from really short would be an hour, but that's not unusual, to 2.5 hours. And then people come back. At first, they're not sure what to do. And then they just start talking. And I write down everything they say. It's not didactic. It's not, oh, well, tell me more about that. Let's be curious. It's nothing like that. I'm just writing it down. It's stream of consciousness. And that's what they're going to sift through to, what about this is transformative? What about this medicine experience do you want to stay connected to? Do you want to learn more about? Do you want to build some practice around? So, yeah.
Is it almost similar to one who goes to therapy, like just normal speaking with a therapist?
It's not really. And that's why I work with adolescents. If the caretaker's on board, I have to do a lot more work with that, because I have to make sure that first of all, the client, the adolescent, what are their expectations? What are their concerns? And then the caretaker. And I'm not going to do something that a caretaker wants that the child doesn't. So I have to do a lot about. Okay.
And so you don't have to be over a certain age to actually go through the
No.
Really?
Mm-mm.
I didn't know that.
Well, my first adolescent client, she's still a teenager, barely, but she's taller than me. But, her caretaker was an integrative medicine physician. This is her guardian, her grandmother, that is raising this child. Interestingly, all the adolescents I've had have had complicated adoption and attachment histories. And, those kids really don't want to talk, which is okay because it's transpersonal. It's between you and your consciousness. I need to know the outline of your life story. But yeah, so about working with adolescents, if you have worked with adolescents before, it's not like they're just, smaller, younger kids. It's a whole different presentation. So if you already have, and I would say years of experience working with adolescents, yes, you do have to find a prescriber that will prescribe to someone under 18. That's not always easy.
Right.
And you have to know the population. It's not just like, oh, this is like a 25-year-old, but younger. No, they have their own stuff going on, their development. They're at a different developmental stage. But yeah, I've worked with a couple.
Is there any side effects being that young and going through that therapy at all? Or
No.
using ketamine at all?
No. I do tell parents or the caretaker, whoever has the child, I tell them, hey, when my kids were that age, I didn't want anything in my house with a street value. And this medicine isn't easy to abuse, but it can be.
Right.
So I caution them a lot about, hey, hang on to this.
Because that's what I've heard as well. It's highly addictive.
Yeah, it can be. And it can be a street drug. And like I said, you'd have to, holding something in your mouth for 15 minutes without spitting or swallowing is the way when it's abused, it's snorted and it's just little bumps of it.
Right.
And you don't get, you just kind of get a bump. You're not.
Yeah, because I've listened to a lot of like celebrities discuss that they're doing it nasal, with the nasal spray and
the nasal spray. Okay, now that's a good thing to bring up. So nothing that I do, nor IV or IM, are covered by insurance. Janssen Pharmaceuticals, several years ago, they split the ketamine molecule in half. So it's a mirror image of the ketamine molecule, and they were able to patent it, and they have a nasal product called Spravato, and Spravato is covered by insurance. It's a nasal preparation. You're getting the medicine in you. The medicine is a good antidepressant. For me, in the way I practice, sure, people do get antidepressant qualities for it and the neuroplasticity. And I have people that come, that's what they come for. But the durable part of it is the trip. Yeah. It's what you see. And it's the things, I brought some things that people have said that, it's just gorgeous. And that's what you build. That's what you build your healing around.
I think that's my biggest thing too, is hearing other people's experiences. The same thing you spoke about earlier, just being able to hear what they've went through, breakthroughs or things that they've been able to understand about themselves. Yeah. I mean, so interesting.
Well, so here's some. I can receive the kindness of others. I'm okay. Someone had an experience of black, heavy blankets being lifted off of me one by one. This was someone with a pretty significant depression. I'm not the story I tell myself I am. We all have a story. You were talking about that. Yeah. The layers, the experience. Sometimes you get to write your story and sometimes you don't. Your family of origin will write it. Your culture will write it.
Environment.
The environment. Yeah. And then, when we're writing our own stories, sometimes we're not too good to ourselves. Yeah. We internalize these narratives. So when you can get separation from your story, that's beautiful. Let's see. I can let go of the belief that I'm not good enough, feelings of acceptance, grace. It just is. If you're not careful, you'll miss it. Be present. How much attention do you want to give the BS? I arrived at a place of deep self-compassion. I could see what I was carrying and what was mine and what wasn't. There's people that do it around loss, can hold the duality of loving the person that they lost and moving on. Yep. You know, in an expansive state, sometimes you need that to embrace those two dualities.
I like how that one person explained the feeling of blankets being lifted. I think that's what I was trying to explain earlier. And now I don't know his or her situation, but and I don't know how to I don't know what word to use, diagnose my level of quote unquote depression, because that's one thing I want to talk to you about. What is depression and what is actually just life? You know what I mean? It's kind of hard to separate the two. Yeah. But I understand that feeling of that blanket being lifted up, that heavy blanket just on you. I think a lot more people have that than not. But how do you differentiate something that is like you are headed in a direction to where you need help, or this is just life you're going through and this is something you're going to get over? So how are you able to differentiate those two?
Well, I do some intake assessments, and you know, there are people that come and they're so depressed, and I'm really honest with them. Like, look, I want to work with you and this can help you, but let's do this. Why don't you try this first? Like this Spravato, the nasal treatment, it's covered by insurance. Yeah. So maybe, you know, do that and get that medical intervention. Or IV ketamine, a series of IV treatments might get your head above water enough for you to lift up and start doing some work. So there are people that I've seen that's like, you know, let's talk about something. And sometimes they're like, no, I want to do this. I'm like, okay, then we'll do this. There are people that are phobic of needles, you know, that aren't going to do an IV thing. So we just talk about options. I want to be really honest with them though. If they can get Spravato treatment that's covered by insurance, and it's not a cure for depression, you know, you still have to have a medicine experience and then do the work. But sometimes you're so down, you can't do the work. Right. And then as far as levels of depression, well, you know, you can kind of see that, you know, I get a lot of insight on the intake process on that. You know, I am a believer that if there's a way, if it's just life, if there's a way to lift it, let's lift it. We don't need to pathologize it. If this can make you feel better, let's do it. You know, let's figure out a way, get your conscious in touch with that and then get some practices in place. I think that life is pretty heavy right now for a lot of people. And, you know, I normalize that without being dismissive of it because it becomes so pathologized. Like if you know, like so to say, hey, yeah, I see you're struggling. They're pretty isolated and they think it's just them. So I want to contextualize for it. It doesn't relieve their pain, and I'm in no way trying to minimize their pain, but it's kind of a shift out of a pathology. You know, this is your fault. You need to do more, you know.
Which a lot of people suffer from. It's just coming down on themselves for it. And I'm glad you said that, especially today, people going through a lot, you know, whether it be financially or whatever it is. Because I think some people maybe dwell a little bit too much and kind of get that victim mentality to where they can never grow out of that. So there's that side. But then there's the other side too, to where if they have other people around them or they're consuming so much on social media, telling them like, you know, basically, you know, don't be a baby about stuff, you know, pull yourself up by your bootstraps type mentality, or it was harder back in the 60s and 50s, like kind of comparing, when I
Mhm.
don't think you should, because I think we all go through our own struggles. Different time periods may have had it more difficult or whatever, but it shouldn't belittle your trauma or struggle through
Mhm.
life. And this is the biggest thing why I hope psychedelics become more readily available, because those people should have that access to that
Mhm.
medicine. I feel like, one, I don't know why psilocybin was a Schedule One drug. I don't know if you know the
I
backstory
do.
on that. Do you? Could you explain
Was
that?
the
Because
war on drugs? It was Nixon.
yeah,
And to be fair, I don't really want to be on the record of being fair to Nixon, but
hmm
there was a lot of abuse and misuse.
hmm
You know,
but there isn't anything in life. I
right?
mean, if
That's
you go
true.
to McDonald's at 7 in the morning, there's a
Right.
line out of the
Right.
driveway, and
Right.
alcohol.
Yeah. Oh,
I
yeah.
mean,
Alcohol for
I
sure.
think there can be an overconsumption of
Right.
everything in life. There's
Yeah.
people that are on social media 12 hours a
Right.
day.
Hmm.
So
Yeah.
why are we taking away from some people who know how to have moderation in life and
Hmm.
can benefit from it?
Well, there's some, I've heard this that, um, who was using psychedelics
hmm
back then? The hippies. That was
Yeah.
not, that was counterculture. That
Yeah.
was not, the American culture.
And they were against the war,
Right.
and they were upset
Exactly.
about that.
Exactly.
Yeah.
And then who was smoking weed? Black people.
Yeah.
So I think, and I don't know this. I'm just saying that's
hmm
a narrative that you hear. Like, how do we penalize these people?
hmm
And I will say though, Tim Leary, he's one of the OG psychonauts, and he did some good things, but his whole thing was tune in, turn on, drop out. Okay, well that's not sustainable. So I think there was a
What does that
element.
mean? Tune in, turn on,
Oh,
drop
just
out.
get high and drop out,
Oh,
Yeah,
oh yeah.
right.
I
Yeah,
remember those commercials.
right.
Yeah.
Yeah,
If you smoke weed, you're basically going to be a
right.
loser.
Right. Yeah.
Yeah. Yeah.
So there was a lot going on, but that was Nixon's war on drugs, and those medicines, psilocybin because you're not going to get well or better if you don't integrate it, and you don't integrate it while you're high, Um, so yeah, there's, there's just, like you're saying, everything can be abused.
I think people just become reliant on the drug because they don't understand that the medicine that's given to them is helping them, but you ultimately need to help yourself as well during that
Exactly.
treatment.
Yeah.
It's not called magic mushrooms.
Yeah.
There's nothing.
They're not magic.
Yeah, they're not magic. You have to. I think it sends you in that state, but you have to be aware and you have to do the homework in order to gain the benefit from that.
Yeah.
So do you see that a lot in your field, like just people relying on that, or you kind of probably do very well at explaining that to them up front?
Yeah. So, the prescriber I use doesn't give a lot of medicine. So,
and not the abuse side. That's not what I mean. I mean more of when they come to you, they think you're going to heal me by just giving me this. I don't have to do anything.
Yeah. I lay that out, and you know what? They are motivated. They are motivated to do it. So, and then when they come back, I do a check-in. So, are you doing your practices? Tell me about what are you doing to stay connected and learn from this and transform. And I get a lot of referrals from other therapists, and I am very open and generous with my time. I don't want to poach their clients. Healing happens in the context of an existing therapeutic relationship. And if I can coach a therapist on how to support their client that's getting, because it works with a lot of different therapeutic modalities. There's already a warm, trusting relationship there. So, you have to do the work. The thing that they say, it's 1% medicine, 99% doing the legwork.
Yeah.
And that's true. The medicine helps. It really does help. And it helps. With ketamine, you don't really have bad trips. But with psilocybin, you can get up against some dark shadow stuff but it comes up because you need to do something with it.
That's what I've heard, because I've had one as well. It was not fun at all. But I've heard, and I've had a hard time trying to understand that. Like I said, I haven't done it enough to maybe have multiple not good trips. But what do you mean by that when you go through something that isn't the fun, positive side of psilocybin? It's the darker side to it. So what do you mean there's something that I've been told there's things you can learn from that?
Oh, yeah. Fortunately, trip time's about 5 hours. And for me, I've had some dark stuff, but it didn't last 5 hours. But you need to be with it. Like, what is that? What is it about? What did it come up? Why did it come up? And really learn to trust the medicine, which I do. With my own stuff, I've had some dark shadow stuff come up. I'm like, I don't really want to deal with it, but just lean into the medicine. What's the lesson? What do I have to do with this now? I have to do something. And then with, I had an end of life experience with ketamine, not me, but a client end of life. And, he was a young married man and had a very, cancer prognosis that wasn't good. And in his experience. So, when you do end of life psychedelic work.
Yeah. Take me down through that, 'cause I know that you've sent me some stuff on that, and very interesting.
So the first time I did it, a lot of things in my life were never strategic. Like things come my way and they feel right and I do it. So a friend of mine, her husband was dying of ALS, and they reached out to me, and this is what I want. And so I met with them, we figured it out. And, that's a terrible disease. Nobody survives it. But I did a medicine experience with him. it was really, really beautiful.
Mhm.
And when I say when I do end of life work, it is beautiful, but at no point am I minimizing the loss,
Mhm.
because people I work with die, and when they're gone, there's women walking around without their beloved life partner. There's children walking around without their fathers, and there's siblings walking around without their brothers. So when I talk about how beautiful it is, I'm not minimizing the loss in any way. So anyway, I worked with him. It was very profound. It was very profound. It was um, well, it was, he got the death acceptance, and he got it in such a profound way that there was no doubt to him or me or his wife that his love is going to survive his body.
Mhm.
And that was like, to witness that is just mind blowing. Another one I did, it was that young man I was talking about. He had a cancer diagnosis, and I did a ketamine session with him. And then I saw him afterwards a couple of times. And in his ketamine experience, it was all about, I'm going to fight this. He pushed the angel of death aside. He had an experience of his wife. They were a young couple, that she was pregnant in his experience. And what I knew about his prognosis is that wasn't going to happen. He already did a very aggressive round of chemotherapy. He wasn't fertile. Even if he had time, he wasn't fertile. And so, I left. He was really an exceptional person, somehow so positive, and but I had I just didn't feel good about it. I was like, gosh, there was no death acceptance. I mean,
You felt like you gave him some sort of false hope?
no, because I didn't give him anything.
Yeah. No, but I mean the treatment itself, not you
Well, he was,
necessarily.
not false hope, but maybe like
Mhm.
a commitment. I'm going to fight this.
Mhm.
And he went on to do this pretty difficult to tolerate sort of alternative treatment. He did that for a while, and then he went to California for a while. So, but then I'm working with his wife, which is not uncommon. The survivor, kind of a transitional attachment figure, and really this man was exceptional. I mean, and also they don't want to explain. She doesn't want to spend a couple of sessions explaining to someone who her husband was. I knew her husband. I worked with her husband. So, but anyway, so she just, after he died, she reached out. She wanted to work together. And she just casually mentioned that he wrote a will. And I was like, oh, she mentioned a couple of times. And I said, oh, so, he said he wrote a will. So he was able to, or not, I didn't ask it like that, but, probing, did he get some death acceptance? And she said, oh yeah, he wrote that after his CAP session. And she sent it to me. This is where it's emotional, but he mentioned a few material things, but what he mostly left was love and forgiveness and grace. So this man, and in the expansiveness of the medicine, he could try to get well with his whole heart, and he could leave his love and acceptance and grace with his whole heart. He could hold those dualities that are absolutely polar. And this man went through so much after his CAP session to try to get well. He tolerated some treatments. He was on a vent for 2 separate times for several days. And so it wasn't a binary thing, and that's the beauty of it is you can have both. You can move, you can live it with acceptance, and you can commit yourself, your whole heart, to in whatever time you have left to living. So it was really gorgeous.
How close to end of life do you perform that treatment?
They have to, it's pretty close, sadly. Well, so the ALS.
Because do they know? I mean, with ALS, you don't really know.
Yeah.
When
And this, everything about this guy was wise, and intuitive. And I tell you, he came to see me.
Mm-hmm.
When he came to see me, he just had a right foot, well, one of his foot, just a foot drop. Looked normal. This was a athletic guy, and just a foot drop, that like you get when your foot's asleep.
Yeah. I actually know somebody who has that apparently.
And then he came back a few weeks later with one of those walkers. It was like the legit walker, not the one with the tennis balls. It was the big time. He needed assistance.
Mm-hmm.
He couldn't, he had difficulty opening the medicine because of his manual dexterity. He died, let me see, he died in October, the first week in October, and we did the experience, I want to say April or May. He was close. And, with ALS, there's this point system. If you can't do this, you lose a point. I think you start out with 48 points. And his points were, at the time that I saw him, weren't, terrible. But you know what? His wife made the point that she said, hey, not all points are the same. And that's true.
Right.
Can you swallow? Is that different from being able to blow dry your hair? They're not the same.
Yeah.
But, I saw him, I did, I'm a death doula, but I really I don't do a lot of that because it's really, I work with people in the context of, of medicine, of therapy. But I did see him after that, and I'm like, hey, I think it's, have you thought about calling hospice? And so it wasn't long. I worked with another woman, and hers was within a week. And the most surprising thing about that is, you hear that well, hers was less than a week. It was a couple of days. I don't know if you ever heard that phrase, there are no atheists in foxholes.
Mm-mm.
Well, people say, like, when you're about to die, you'll find God.
Yeah.
But she did not. She was an atheist. She lived as an atheist and died as an atheist. Which I thought was interesting.
Yeah, because usually people, as they get older, or they, like you said,
you're
close
looking
to death
in the eye.
Yeah.
You think, but she was an atheist, and it's never ever appropriate for me to proselytize or, I honored her in my own way in understanding of her existence. But it was interesting she was so firm in it, and she died, I don't know, it was 2 or 3 days after I saw her.
How does that experience help them? Like, if you can explain a little bit in detail of kind of accepting their situation.
Well, I think when they can have a sense of that something survives them.
Mm-hmm.
And the one person, just him knowing that his love for his family and his family love for him,
mm-hmm.
He used the word tangible.
Yeah.
And they all had peace around that. It was really moving, but his wife came in afterwards, and they were just so united, and, this survives. This is going to be more, this love is not going anywhere. Mm-hmm. And it was such a felt thing,
Is it because during the whole thing, they're kind of probably more in I don't know if this is the right terms to use, but like a negative mindset because of the situation that they're in, and then the therapy that you offer kind of uplifts them out of that?
I don't know. This man was, for the most part, there are exceptions to this, but, the people that have found their way to me have honestly been exceptional.
Really?
If I can have the courage and grace of some of these people, and I always ask myself, wow, would I do that? Could I handle it like that?
Maybe behind closed doors, though.
I know. Well, you get in behind the closed doors.
Yeah.
They do let you in. Like I saw, one of them I saw afterwards. But yeah, you do kind of see them on a high,
mm-hmm. Because in front of you, they may be uplifting because they're actually probably excited and happy to,
But I work hard to create a space where no one has to perform
right.
wellness.
I just think naturally human beings, will do that. I find it even myself, it's hard to discuss what's going on up here.
Yeah, but that's my job.
Right.
It's my job. And I think that
I guess you're right. You kind of
yeah.
dig and
And
find
I
that
can
out.
tell when it's not happening, and I'm patient with that.
Mm-hmm.
But the way it helps is when it's psycho-spiritual. So then it's like, okay, yeah, there is something there beyond this. And really, you know, a trip can feel like you're dead and you've left your body. And that's often really nice, you know?
Yeah.
So it can help with that. It can help with death acceptance. There's a cancer center it's in New York, I believe, and they have a huge psychiatric oncology department. So they're looking at people, the psychiatry of a cancer diagnosis, end of life, et cetera. And they've developed a tool for an assessment of there's a thing, desire for a hastened death. I've worked with that too. Like, hey, this isn't going to get better. I'm going to suffer. And the parameters of that are kind of loss of meaning, suicidal ideation, loss of dignity. I mean, you know, their bodies, you know, all their systems are failing them, and demoralization, depression. So a psychedelic trip can work with those. And you don't have to hit all of them. You don't have to go through that whole list of the factors of desire for a hastened death. If you can hit one or two of those and just have people have a sense of peace, acceptance of the time they have left. Yeah.
Let's take a break real quick.
Okay.
And then I want to, we'll wrap it up. All right, we're back.
Okay.
So I wanted to go down and kind of hit on the veteran side of what you offer. Could you kind of take me through that on kind of helping out? Because I know this helps out with depression, suicide, you know, all that stuff. But the PTSD side of it, we hear it all the time, you know, especially combat vets coming back. How does this help them?
So I work with vets. I offer a significant discount to veterans, first responders, and it helps with the PTSD. And I will say this, I work with combat vets, and that's a very difficult thing. The things that they've had to do and see is very difficult. And when you work with first responders in the community, they're exposed to their trauma daily. They're driving by places where they pulled someone out of a burning building. So, you know, they're both very much needed. Both populations need a lot of help and support around their trauma, their deactivation. You know, when your trauma requires you become hypervigilant, and you can't shut that off. You can't shut that off when you take your uniform off, or when, you know, you walk in the door of your home, your wife and children, and you're hypervigilant. And your body, your physiology responds to that. So it's a population that needs support. I offer a discount because it's what I do is expensive. And, you know, they're part of our community, and then service members, you know, we ask a lot of them. You know, we ask an awful lot, and I think we have to honor, you know, what they've given and what they, you know, what it costs them.
Yeah. Are we talking like police officers and stuff like that?
Yeah,
as
I
well?
work with vets, you know, the people that serve.
Do you yeah. Okay.
And
them as well.
first responders, firefighters.
Yeah, first responder. Yeah. Do you see a lot of things like PTSD wise? Because I've heard, I mean, you know, people when they think PTSD, they think of a combat veteran, but also some of these police officers or, you know, God, I'm losing the word for the ambulance, EMTs, firefighters. Surely they deal with their.
You know what they do, and the thing about that is, they're going back. You know, they're going back to it.
The tour never stops.
Right,
Yeah.
the tour never stops.
It may slow down.
They say it's a slow burn. And you know what? They don't want to walk around with their guns out. You know, they don't. Right. You know, they don't want that. They don't want to take a life, and they want to go home. So, you know, I think we had a past couple of years where there's a perception of law enforcement, and um, I I just see them as people,
Mm-hmm.
showing up, and sometimes on paper when they do their intake, I'm like, oh, this guy, But then I meet him, and it's just a human being
Yeah.
doing a job, um, and it's not so much. I'm working with someone that their gig was child enticement. So for 8 hours a day, they pretended to be, a 13-year-old little girl, and they're speaking to perpy men that, you don't think that gets in your head.
Yeah.
And especially if you have daughters.
Mm-hmm.
So yeah, it can be the violence, and it can be those mind games. And I worked with a vet too that did it was really kind of like this spy stuff, and he was very cautious about what he said because he was very well trained.
Mm-hmm.
But his role was um, to present as something completely different. And he received a lot of training from the federal government on how to do that, and training about how not to do it. When you're not doing it anymore, there's a transition period. But
Yeah. Which I heard is very difficult. That's one of the hardest things, to transition
yeah,
from work to just normal civilian life.
yeah,
Yeah.
yeah. I think this guy was doing the best he could, but he understood that it was kind of psychological warfare that he was involved in, and the stress of presenting as living a double life, the stress of that.
Did that make it difficult for you to try to break through? And
No, he was really open.
okay.
I mean, it was a different presentation. It was different.
Mm-hmm.
I think working with someone who is that embedded in a system where he couldn't present as himself,
Mm-hmm.
and it was life or death, not just his life or death. I think that's pretty deep. But he was motivated. He had been out for a while, a year or two.
And he was seeking treatment.
Yeah,
So
he was
wanted
motivated.
yeah. I just didn't know if sometimes kind of how we physically, you have muscle memory on things.
Yeah.
Maybe psychologically, he didn't notice himself doing it,
Yeah.
but he was kind of manipulating or,
Yeah, I think, the way he described it, part of, his deployment, they ramp him up for that. And then when that's over, he described a period of a transition period where he got a lot of support around not being that person anymore.
Mm-hmm.
Yeah.
Gotcha. So what else, like how does the ketamine help with PTSD? I'm sorry if I've already asked this too, but just so if any veterans are listening and they're seeking treatment, they can kind of understand what it'll kind of do. Is it kind of the same thing just for, normal civilians dealing with depression? It's kind of the same.
Yeah, it increases connection to self.
Mm-hmm.
And the self is gentle and good and calm. So it gets some distance from that story. It gets a level of detachment. When your survival depends on, who are the bad guys, who are the good guys, it gets you like some softening around that hypervigilance and always having to assess. It allows you to connect to parts of yourself that are loving and gentle and not going to need to respond with aggression. So it does soften things up quite a bit. And I'm anxious, in Missouri, the veterans community has been the muscle, really showed up in so many ways for promoting access to psychedelic medicine, because these bigger medicines are going to be more effective than psilocybin. I have vets that come with some frequency. I have law enforcement. I have first responders. They come. It's helping. And, let's do more.
Yeah, especially with first responders. I've been very vocal on this for a while. Have had different views over time. But now at this point in my life, I look at it as, I think as civilian wise, I think people are expecting and demanding unrealistic things from these positions, cops, firefighters, EMTs. I think, especially police officers as well. And I understand there's good, bad apples. We spoke about that earlier in everything. Okay. And I'm not giving it an excuse. I hope these organizations are doing their best to weed those people out. My thing is that I feel like, when it comes down, to defense, people need to really look at themselves, honestly. Police officers will tell you all the time, they show up usually after the crime is committed. So I think as a people, we need to more of, do things on our own as well. Like, if you shouldn't be in a certain place, or have situational awareness or whatever it may be, if you feel that a gun can help you in defending your life, whatever it is. But let's kind of back up and stop putting so much unrealistic expectations from these police officers. And I think that would be kind of the balance of the fighting we see right now, and then also too, these organizations need to stop demanding so much of their, people as well, the higher ups, there's so many things I feel like they're doing currently that they don't need to be making these guys do, these, guys and gals. They could be doing other things that could benefit the community. You know what I mean? So, and also too, we forget, all the things that they're seeing. I mean, the fighting, the arguments, the just constant tension. I mean, that's literally I'm sure some of them, depending on what county you're in or what city you're in, it's a little more lax. Some of them it's not. Some of them it's just constant. I mean, you see the worst of the worst. Yeah. So how does that not change you mentally?
Well, and I think, we can all agree that the good guy with a gun narrative doesn't work. The Chiefs Parade, there were 800 good guys with guns, Well, I think there's certain situations that's just you can't avoid. You know what I mean? But, and then the when they went out to serve a warrant and, law enforcement was killed. But but I think, I don't I haven't talked to the person that it's FOP, the police union, but I have an associate that has, and they want access to medicine because they don't want someone on the force that is so activated that it's not just for the medicine for them. Like they feel like they're gonna be better cops and safer cops if they're de-escalated. So it's not just like, hey, I want to go home at night. They're like, hey, I want my community to be safer. I want to serve in a way where we make people as safe as possible. So yeah, it's a group of people that needs the medicine. And I really I've come to really like the cops I work with. I mean, and have an appreciation for what they do. And really the best thing about ketamine and psychedelics is you get to see, behind your story, about my story, you think of someone you think is so objectional, behind their story is just a beautiful conscience. It's just beautiful humanity that's there. And so I've learned that, no matter who anyone is, I've learned that I just think, hey, I know you're in there. I know you're awesome. I know you're in there. And that's how can I meet you there?
And that's kind of what I mean is that some people, I think it's so lost, they become these bad people. You know what I mean? Because they're kind of becoming a part of their environment. And if we can, like I said, on the people more, I just feel like we could do a lot more instead of relying, sometimes give these guys a break. I understand what you said. Not always is people with guns are going to be able to defend themselves. Case of the Chiefs Parade. But at the same time, we've seen thousands of stories of people protecting themselves in their home, invasions, stuff like that, or lady walking home from work, able to defend herself. So
I think there's more misuse of guns than protective use, though. I think. Really? Oh yeah, I think the data supports that.
Well, I've seen data on gun deaths. Actually, over half is suicides. I know that kind of gets lumped in there, but and a lot of people don't know that. Colion Noir is, I think, one of the best ones to break down all that data. If anybody wants to watch his stuff, he's a lawyer. He's really good at a lot better than I am. But I bring it up just so, like I said, we're not putting these cops in a lot of these situations that, maybe they just, their services can be used better somewhere else. You know what I mean? Like, that's kind of what I mean by that. But, and also your treatment as well, I think I think that should be a mandatory. I mean, if anybody's, if an officer's involved in a shooting or, rescuing a child who's been sexually abused, all that stuff weighs on them, because they have a daughter or a son or whatever it is, and I just think over time that builds up, and depending on the person, not everybody's the same. So they're going to take it differently,
And really none of us are, we're a species that's, we live in community and connect. So when you're constantly exposed to an unsafe community, a fatal lack of connection, that will take a toll on anybody. Yeah. I don't know if KCPD or what other agencies are self-insured, but it would be nice if they could, offer that. I know that they, because like psilocybin and marijuana are not federally legal, they can't do anything with that.
Even if they're state?
No, because most law enforcement agencies get most of their money from federal agencies.
You're right.
And they get a lot of other support, equipment, all training. So they're kind of in this box, even with marijuana. That's why I offer ketamine. I don't, like you're saying, I think there's an exaggeration of the benefits of marijuana. And some people can, but, benefit from it. But if a police officer can't even do that, I think that's why I see so many, because they need to feel good in their bodies. And
because they're allowed to do.
Right. It's perfectly legal.
I didn't know, because, when it comes to law enforcement or I know psychedelic wise, that's like.
Because none of them are federally.
No. Yeah. And I think a lot of them probably view it altering the mind, all these past.
Well, they're secretive
it's not
about
real.
it.
Yeah.
And even if it was covered by insurance, I don't know if they'd submit it, because they wouldn't want, there's always this suspicion that your employer is going to know. I've worked with people with security clearance, and they're, a little concerned about it, but.
Being singled out, possibly.
Yeah. Because I think to get clearances, I think you have to make some agreement that you won't do certain substances. Right. But if you have a prescription for something, it's typically, okay, I got a prescription. It's okay. But yeah, I do. That's why I offer, if I did everyone at that rate, I wouldn't make any money, but it's the right thing to do. Yeah. And, I live in the community too that they live in, and so
and I'm hoping kind of touch back on what we were talking about earlier, like you said, people in certain environments are going to have to go through a lot more than people in other environments. I really hope that maybe not ketamine, but there's something that can give access to people who aren't able to afford this, the medicine that you offer. Because there's a lot more people that aren't able to afford it than are given something to help. You know what I mean? I don't know what that would be. I don't know if maybe you've thought of that. Like maybe there's another alternative.
I'm a clinician, and I think if you're struggling, you need to be in a place with someone that can support, that can understand your struggle, the etiology of it, what maintains it, can have an understanding of what it is, diagnostically. Without without labeling someone, but I think that it absolutely has to be more accessible, but I don't think that, just having all this access to any type of medicine is going to be the answer.
Right.
I just think you need some support, you need some structure, you need someone that it's not for everybody. None of these medicines are for everybody. And I think you you want to do a proper assessment. And that's how that it has to become affordable. You know, it just has to become affordable.
And I totally respect your decision on that. Especially, you know a lot more about this than I do. I just, man, it just kind of sucks because I just know there's a lot of people out there hurting and could really benefit from it. And I'm not taking away at all how much it costs. It's a lot goes into the process, so I completely understand. I just wish there was something that could help others, that unfortunately don't have that access, so that's kind of where I come at it from.
I'd like to see,
because I would like to see a better world. I just see so much
but medicine necessarily, I was talking to a man, he's Native American, and he's probably in his 60s, late 60s, I don't know, but so his culture uses peyote. So he's been using peyote ceremoniously for decades, for most of his life. And he said, we were talking about that, and he said, yeah, the thing is, if someone was an a-hole before medicine, they're going to be an a-hole after medicine. So really? You can't be too, medicine is part of it. It's not all of it.
You don't think that some people become like an asshole because just life has kind of beat them down and that's the way they took it? So do you think that, but you think that can kind of be helped?
Yeah, that can.
Because, he's saying that basically if a person's like that, and I'm sure he's not saying that for everybody, but they're going to be like that even after.
If they want to be, if they want something to be different, the medicine can absolutely be a catalyst for that. But you're saying that
it's not, the medicine itself is not going to, it has to be you.
The longer you're in this, you will meet people that have what looks like healthy relationships with medicine.
Yeah.
And, they still have, I think we're all on our journey, but medicine isn't a cure. It's not a cure. And it was interesting for this man to say it because he's only used it, in the Native culture, it's ceremonial, it's beautiful, it's spiritual. And he's saying, if you're an a-hole before, you'll be an a-hole after. And I knew that. Yeah. I knew that, but I thought it'd be different. In ceremony, I was kind of hoping it would, but no.
Have you done a ceremony like that?
No.
I heard that peyote's intense.
Yeah.
From what I've heard.
Yeah, I don't know. I would like to, but you have to be invited.
Oh, okay.
You can't just, and that's the thing. It's a lot of cultural appropriation going on in the psychedelic space. So, if I get invited to do it, I would do it. I've done it. My big psychedelic trips have been psilocybin in Jamaica, at retreats. And
I know culture can be a beautiful thing. I get it. But do you feel like sometimes that people should still have access to some of these beautiful cultures that offer stuff like that?
If it's their culture, if I'm invited to a native ceremony, But this is the thing is, if there's 100 Native Americans or Hindus or something that in 99 said, yeah, go ahead, do your Shiva chant or burn your sage. And then one says, yeah, no, that's not your culture. I'm not doing it.
Yeah.
I'm not
even if others are okay with it?
If
and it's just one person that says,
I will honor that.
Really?
Yeah.
I just feel like sometimes it would be nice, especially I've seen people that aren't from necessarily that culture that have immersed themselves into it with total respect.
Yeah.
I just feel like it would suck that they're not allowed to just because they don't.
Well, they're doing it anyway.
Yeah.
They're doing it, but in a Western therapeutic model, I'm not going to inject it in there. And, I worked with someone that was, she was Norwegian. And okay, how do we, that's the Vikings, there's gods and goddesses. And so I did a playlist of Norwegian music. There are, if someone shows up, like say a really white person that shows up like with a feather or something, and, I'll ask about it. And if it's, I'm not going to say like, well, where'd you get the feather? Does that belong, I will honor whatever people show up with, but I'm certainly not going to direct them in a way that,
and I respect your belief on that. My thing is I just feel like sometimes these trendy, like cultural appropriation sometimes can be taken out of complete context. There's some people that are just really respect that whatever they're doing, and they may not be from it, but they really respect it and want to be a part of it. That's the community they want to be a part in. And it's just sad how some can take that from them just because they're white or they're black
Well,
or
I
they're
still
Mexican.
think they're hanging on to it. I mean, no one's
Yeah.
taking it from them.
Yeah.
They're hanging on to it. I've never
Yeah.
I've seen someone like
But they're labeled and they're kind of judged by some. You
by
know what I
some,
mean?
but they're operating in a space where it's acceptable because they keep doing it.
Yeah.
But I do, it is offensive to, I've heard of people that, talking about people, Indian people talking about this white guy that's Hindu now. That just doesn't feel good.
Yeah. And I'm sure there's some that are upset about it, but just from my, being my father being Mexican and my mother being white, I've seen a lot of people on my Mexican side say they're fine with it. They don't mind, Cinco de Mayo comes around, it's no big deal, or even my Irish side, there's people that dress in green and, wear 4-leaf clovers or whatever. And there's some that are going to take offense and some that are not. My thing is just kind of let people live and just let,
Someone shows up with all the stuff. Like, I don't care where they got it.
Yeah.
If it was part of their heritage or not.
Yeah. But at the same time, I don't want to be disrespectful and tell somebody, well, you can't think that way. If you're offended by it, you can't be offended.
Yeah,
I'm not saying that at all.
Yeah, me neither.
If you're offended by it, that's fine. But I think that maybe that's something you should, personally, don't take it away from the other person who has done nothing to you other than want to be accepted by a certain culture. So, but I also have seen too, even just watching the documentary on Netflix. God, what was that called? It was on psilocybin. Have you ever heard of Mary Sabina?
Oh, Maria Sabina.
Yeah, Maria Sabina. That's what it is. They said she was the grandmother of psilocybin. She was from I don't know what town in Mexico she was from, but they kind of dealt with, in a sense, not cultural appropriation necessarily, but an influx of Americans coming down to the town and not being respectful to the medicine. So then she was kind of outcasted and by the town because they were very upset. But see, I think that was wrong of them to do because she didn't know. She was just trying to spread what has given her so much joy and others around her joy to others. She didn't feel like, and this is just me trying to understand it. She didn't feel like that's something I should be the only one to keep, or my people are the only one to keep it. I think other people should have this experience as well. It just unfortunately went the way it went.
Yeah.
And, but I think without her, because I think the one who discovered her, his name was Gordon Wasson, that JP Morgan broker. Right. He was like an amateur, what is it called? A mycologist? Yeah. And his wife, Dr. Valentine Watson. They were the ones, and then they wanted to bring all their friends and stuff or I think they actually brought, was it the guy who created ketamine? I can't remember. They brought somebody down, some scientist down, and introduced her to him as well. And they have it's a great documentary. I have it written down here somewhere.
I'll Google. I'm a fan of Maria Sabina.
For people who want to watch it, I have it down here somewhere. Where is it? Oh, How to Change Your Mind.
Oh yeah, Michael
on
Pollan.
Netflix. Yeah, and also they talked about, we discussed on break, Paul Stamets and
Well, in a way, we all are culturally there's a medicine. It grows in Africa, I think West Africa, ibogaine. It's showing one of the few things that show really powerful efficacy on addiction, particularly opioid addiction. And in Mexico, you can go to treatment centers. In Missouri got money from the opioid settlements. There's an interest in studying ibogaine for that, and why that is cultural appropriation. We would never come up with that. And it's a pharmaceutical product, or we can replicate it into a pharmaceutical product that can work like when many other things have failed. So, I think we just have to be careful. And I think
respect is the biggest thing.
And I only do what I'm invited to do by a member of that
Right.
community. I'm neutral. If someone shows up, white person shows up with all their stuff, I don't say anything. That's their stuff. That's their ceremony. But I'm just careful
Yeah.
about.
And I think, too, I mean, a lot of medicines are made from certain plants and around the world. So if we didn't have access to them, we wouldn't have some of the great medicine we have nowadays. So,
And, like Maria Sabina, she was born in 1894, but, if she was if we just let her, we can't all go to Mexico and, do ceremony with her.
Yeah.
So to scale it up, it's going to be disconnected from culture. But I
Right.
just very cautious about that.
Yeah, and that was the thing Paul Stamets talked about. The beautiful thing about psilocybin is it can be grown anywhere.
Right. Nobody owns that medicine.
Yeah, it's everywhere. And I mean, just how incredible he was. Self-taught. I mean, discovering 4 new species of fungi. I mean, it's pretty cool to see somebody immerse themselves into their work and just, flourish the way he did. I mean, it's amazing. He's yeah, he's definitely an interesting guy. But yeah, I mean, it's interesting. I really enjoyed discussing what we discussed today. I do have one more question before we wrap it up. You spoke earlier about helping children and adolescents with the therapy that you offer. And you spoke about, I think you said that adolescents in depression, and there was another thing, orphans.
Well, they weren't orphans, but it had complicated,
maybe adopted
complicated adoption attachment histories.
Have you had to deal with any children that have been victims of sexual abuse? Because I know that's a thing that I feel is discussed. I don't feel like it's discussed as much as it should be. I have met people personally. I have read countless stories, listened to countless podcasts of women and men that have gone through sexual abuse as a child. And a lot of times by a family member.
Usually.
Yeah, which is horrible.
Yeah.
It baffles my mind. Is this something that can help them?
Yes. I see a lot of survivors, adult survivors of child sexual abuse, from a caretaker, from clergy abuse. That's, a big chunk of my practice is adult survivors of sexual abuse. When I worked at Mox, everyone was affected by sexual abuse, children. And it can help.
Yeah.
It can definitely help.
Because I find that people that have dealt with that, they have a hard time discussing it, especially as they get older. I think they've suppressed it for so long that it's just, if you don't think about it and you just act like it never happened, or if you put it away, sweep it under the rug, you'll be okay. I don't want to bring, and I totally understand. I use that cautiously because I haven't been in those shoes, but I understand when they explain it to me. But I think that is probably the worst way to go about it, because they don't necessarily see the effect that it has on them, but they're living their life with that trauma. It can dictate things that you do in your life. I mean, it can really all around. I just think it's best to go and seek treatment. And I think that's what is hard for a lot of people. They don't want to relive that experience. Is there something that you can kind of say to them if they're listening of why they need this?
Well, I think what stops people is not being believed. Like you said, it usually happens in the context of something that someone you should have been able to trust. So disclosing it can feel really bad. It can tear a family apart. Sometimes they're not believed, or the family system has to stay intact. So there's so much shame. But I tell you, I worked at Moxa, the sexual assault organization, for a long time.
Are they here locally? Okay.
They're on Broadway right now. Yeah.
How can people get?
Just look up Metropolitan Organization to Counter Sexual Assault.
Okay.
Free services.
Because I've dealt with Rain.
Brain, yeah,
Yeah,
that's
I've
the
donated.
national
Yeah.
organization.
Okay.
Yeah, this is the local one. They're on 31st and Broadway,
Gotcha.
um, and they have really good therapeutic services.
Uh-huh.
It's free, so yeah. So I worked with it a lot, and just get help from someone who knows. I would really want to know, because there's certain experiences that if you're not trained in it, if you're not experienced in it, you'll do more harm than good as a
Right.
clinician.
Right.
I think there's a lot of shame attached to sexual abuse. um, uh, you know you unfortunately there's still that, well, what were you wearing, where were you, oh, why are you so drunk? you know Child sexual abuse, the child has to hold the duality of, this is my caretaker and I love them, with I'm
Hmm.
being harmed. And I see that a lot, people growing to adulthood,
Hmm.
holding those dualities. So get help. It does get better.
Yeah.
I've worked with so many people, and just coming into that place of wholeness and releasing that, and
Hmm.
just being with them, telling your story. Just allow someone to witness it.
Taking that blanket off, like we
Take
spoke
the
about
blanket
earlier.
off. Yeah.
And I think, especially with that, I mean, that's such a horrible, just, trauma to have, and to bear that by yourself throughout
Yeah. In
life.
isolation.
Yeah. And you even bringing up them not being believed,
Mm-hmm.
because, and I didn't, like you just like clicked the light bulb in my head. Yeah. I mean, literally a person that you trust, or a person close that you trust, or what, even if it wasn't, like, you just, it's something so crazy that you wouldn't believe would happen. And then you're either told to don't say anything,
Mm-hmm.
or you're crazy, you were drunk, or whatever it is, the
Mm-hmm.
situation that you're in, or, don't tell anybody, because I'm whatever parent or uncle or whatever
Mm-hmm.
aunt, I don't know what it is, but whatever it is, and then you grow up and you have those trust issues, or that feeling of like, I'm never going to be believed about this, so why even bring it up? And they don't see that that's going to play into your relationships, your
Mm-hmm.
friendships, your
Mm-hmm.
decision making.
Your
And it's,
parenting.
yeah, your parenting,
Mm-hmm.
it's really going to hold you back in
Mm-hmm.
life, because you weren't able to get with somebody, a professional, in order to figure out. And you have to, the same thing we spoke about with the therapy that you offer with
Mm-hmm.
people dealing with depression or suicide. It's the same thing. You have to want to attack this and heal from this,
Mm-hmm. Yeah.
And I can't imagine. I mean, it's easy for me to say, but I'm sure it's such a difficult
I see
process.
so much beautiful healing. And I
Hmm.
do think that humans, there's a phenomenon in plants, it's heliotropism, where a plant will turn to the light. And I
Hmm.
think you give humans the right support, the right tools, the right environment, they will turn to the light. Hundreds of people, with my work at Moxa, and um, you can heal from it. You can heal and be whole.
Hmm.
Um, yeah.
I agree. I agree. Well, I want to thank you
Well, thank
for
you.
coming
Thank
on.
you for your curiosity.
It makes me just happy that there's individuals like you in the world that are helping, and, just making people feel better, and I think it's just something, like I said, I sometimes feel like it's just overlooked,
Mm-hmm.
just deal with it, just deal,
Mm-hmm.
and it's great to have people like you
Well, and
that
you
will be
too,
able to offer
Gabriel.
services,
You can amplify the voice.
Hmm.
You can amplify that. So
And that's what I'm
I
hoping,
appreciate that.
I'm hoping to have more people on like you. If there's ever anybody that that you recommend, I'd love to have them on. If you'd
Mm-hmm.
like to ever come back on again, you're always
Mm-hmm.
welcome. But yeah, that's kind of my thing. I want to give people voices. I want to give, whether I agree with them or not, I think people should still be heard.
Mm-hmm.
And I hope in the end that people can listen to this, and even if it's only a 5-minute segment out of a 2-hour conversation, it can help them just a little bit. Because that's what, believe it or not, I know podcasts are way blown out of proportion now. Everyone's got one, but man, they have benefited my life. They have helped me meet new people or understand different things or whatever it is. Like, just experiencing new things and learning new things, or even meeting you. Like I heard an interview that you were on with North Kansas City. That was a great, 1 hour segment that I listened to, and it connected me with you to where I got to sit down with you today and learn so much. So, again, I appreciate it. And is there anything that you have coming up that you want to share, or?
Well, I've been invited to speak with a group of women's veterans about sexual assault in the military. This is really wild, but over a year ago, a MU film student reached out to me and said, I want to do my documentary film on your work. And it took him a long time to talk me into it, because like, what? I don't know. Because I am selective. I do say no to a lot of things, but
I think you'd be great at that. I'm
well,
really looking forward to that.
I'm been so impressed with him in the program. Part of his campaign to convince me is I spoke with his advisor, who was a health reporter with NPR, and they sent me some of his work, and it was very sensitive. And so we have creatives, that are doing cool things.
That's awesome. Yeah. That's awesome to hear. Is there ways they can reach out to you? I'll have some of your stuff in the notes.
Yeah. So they can Google me. Just Google my name, ANNEBETHUNE. My website is kapkansascity.com. Okay. And I welcome that. I knew when I started this work that no one else was doing. It's still new, but there's about 20 CAP therapists in Kansas City now. But I knew part of my role would be psychoeducation, educating people on what this is, how it can help them. And that's what I, a lot of the stuff I'm asked to do, that give talks like North Kansas City and this, and testifying, it's education. And so I welcome that. I knew that was going to be part of the deal, and I'm happy to do it.
That's awesome. I'm glad that you're out there speaking about this. I mean, I don't know how many people are here in Kansas City. I don't know if you're one of the, for right now, the only one I've seen is you, and I've, done some research on it, and not as much, but I've done some research on it. But, we just kind of glanced over real quick. I promise I'm gonna wrap it up, but the sexual abuse that's happening in the military. I remember that story that happened to that poor young girl. What was it, in Texas?
Yeah.
That's just horrible.
Yeah, it is. And you have all that chain.
What are you doing on that?
I was invited to speak. This is a new connection that she reached out to me. Oh, it's been a month or two. And I know, it was March, and they were having an event, and they wanted me to come speak. And it wasn't just, women. It was just an event, I think, for military and law enforcement or something. And I'm like, I couldn't do it. And then she said, well, we're having another event in July, and it's going to be women. Talking about
and what are you going to speak on with that?
It's just what I do, and therapeutic.
Oh, how you can help.
Yeah. And especially vets, I offer discounts, so, and they have trauma. So, and then education too. There's a lot of self-blame that goes around with that. And, a lot of sexual abuse, like clergy abuse, things like that, they happen within a hierarchical structure, so.
Why is there self-blame?
Self-blame, there's just shame. There's just shame around.
I know, I've always tried to wrap my head around why the victims blame themselves.
Yeah. I don't. You know why? This is what I kind of came up with working with kids is, I'll give you an example. So
are they groomed that way? Like
that's part of
it. Abusers telling them, but this is your fault.
Yeah, but this is the thing is, and this isn't exactly sexual assault, but so I was seeing this kid. It was a little boy. He was like 5, and his father was killed in a car accident, and they, there's a lot of people around, and in the all of that, there was a period of time where he was being abused by like an older cousin or something, and so I do this modality. I'm trained in play therapy, and there's this modality. It's called sand tray, and what it is like I have hundreds. I kind of have a problem, but I have so many of those miniatures, and I just get a sand tray. It's about this big, and tell me a story, and I get all my miniatures out, and so this child, he just did it, and they do it quietly. It's kind of a pre-conscious process. And so he did it, and I watched him, and he buried this car under this big mountain of sand, and he stopped. And I said, okay, well, yeah. Oh, you don't say anything of value to it, but just kind of look at it. And he said, did my mom tell you my dad died? And I said, yeah, she did. I'm really sorry about that. And he had the car, and I'm like, well, tell me what's going on in your sanctuary. So we buried a car, and that was the car his dad died in, symbolically. And he said, I think my dad was really tired because he stayed up and played with me the night before. And this is what I see with sexual assault survivors, with a lot of people. So he's a kid, he's 5 years old. And for his little mind to accept that one day you're playing with your dad and the next day he's dead, and that you have absolutely, just the randomness of the universe. I think people assume responsibility because it's easier that way. Because you have these, if I had only done this, that gives you a lot more control than you really have.
Yeah.
Like if I only didn't get in his car, if I only wore something different, if I only had didn't have that drink, if I only had a sleepover that night instead of being home, I think it gives you a sense. We all want to find a sense of control rather than the randomness of the universe. So that was an example of that. And I think that's where the blame comes in. Like if I only hadn't gotten so drunk, or God, I saw the red flags and I went out with him anyway, or, in a lot of sexual abuse in a family, there's one main child. And so that child has to come up with a reason why it's them and not their siblings. So I think shame and just if you really just sit with the idea that this can happen, your dad can die in a car accident, and your stepfather can rape you. You just have to. Yeah. It's our human thing. It's like I shoulda, coulda, woulda.
Yeah. No, I totally understand that. I mean, even me personally, dealing with the death when I was younger of a cousin of mine, and he had asked me for a ride that night, and I was like 16. It was really late. I couldn't go out. I had a curfew, and he died that night, and he was shot. And for a long time, I felt the same way.
Because you didn't want to.
Yeah, because it's not like
your cousin could just randomly get
and it wasn't
shot.
like as if I didn't want to. I just couldn't.
Yeah.
And it took me a long time to realize that wasn't my fault, and because there's a long, he has his own path. The decisions that he made put himself in the situation that he was in. And I'm not trying to be messed up about that at all. And I'm not saying he intended to be shot, but there's a long backstory behind why those things happen, him personally. So it took me a long time, though, to figure out, like, oh, Gabriel, this isn't your fault, man. Like, if you had the opportunity, you would have. But, I struggled for so long of, if I would have, he would have just still been alive. But then I would tell myself, well, would he? Would it have happened next week or a month later or a year later? So I could see that. And that's on a very, very impactful to me, but maybe small to other people's situations, like victims of sexual abuse and stuff like that.
But we do it as parents because we have to. Don't you want to believe that if your kids do everything you tell them to do, nothing bad will ever happen to them?
I would like to believe that.
That's right. That's why you lean so hard into it. They could do everything that you expect them to do, and something bad. But we have to have this feeling that we have a little bit of a control.
Yeah.
Your kids can do everything right, and that's what, and that's worse. I'd rather something bad happen to me than my kids.
Me too. Yeah.
Yeah. So it's just how we are.
Yeah.
Yeah.
And that's even a hard line, because of being too overprotective or
Right.
not being protective enough. And I mean, because so many things could happen. I mean, even just, I'm sure you've seen it, just children playing with other children, things can happen, and then who's to blame there because
Right.
they're both children or, whatever it is, spending the night at a friend's house, they're, I think an open line of communication with children is the best thing that you can do. I've had to work on that, trying to not just be dad, also being a friend in a sense to where she feels comfortable with coming to me, and it's been a very hard road for me to figure out that, and every day I'm trying to get better and better at it, because the last thing I want is for her to feel like she can't come to dad or mom because she feels like she can't talk to her parents, so, and I'm fortunate enough, thank God, my wife is a saint when it comes to our kids. So I know there's always a direct line of communication with her. And I'm also trying to learn more from her on how to be that as well. So, but that's kind of my, just personal advice. I think if parents more gave that path for their children, they would be a lot better at opening up and maybe discussing it with them than sheltering and, hiding it from them because they feel a certain way about it. So, and also speaking about it, talking about it more, I feel like so much that it's like taboo to discuss.
Yeah.
Normalizing it, not in a sense of
Right. It's
normalizing
normal
the
behavior.
act.
Right.
Yeah. But normalizing the discussion of healing and therapy and being open about it, that you're not going to be looked at any differently. So that's kind of what I mean on that.
Yeah.
But thank you again.
You're
I
welcome.
appreciate
Thank
it, Ann.
you. All right.
You're welcome anytime. So,
Okay.
all right.
All right. Thanks,
Thanks.
Gabriel.